This is a record card which I've just created for a new patient. I've just put a few details onto it. First line of address, phone number, PPS number, medical card number and expiry date. Because the patient's got a medical card, I'm going to right click on his name and select GMS. The program now tells us that he's due for a GMS exam and can have 2 fillings. It's doing this based on the information that we have stored in the system for this patient, which is nothing. If I click on the HSE button here, I can check the validity of his medical card. And because it's a number I've made up, it unsurprisingly comes back as not found in any scheme. This box here, if you click on it, will show us any other patients in the practice to whom this patient might be connected. So it's giving us 2 names. The first name, as we'll see, is because it's linking these 2 patients based on telephone numbers. This patient's number is 777 7777. There's no area code in it, so it's assuming it's the local area code 051. So that enables it to link us to this patient here, who's got an 051 number with the same phone number. It's also linking this patient with this patient here, and it does this based on the fact that it's got the same surname and the same first line of address. Photographs of patients can be stored in the record cards, and it's quite easy to do if you've got a webcam. You just right click on here, select take photograph, take picture, and that's it stored to the record card. This field here is the dental recall field. This one is hygiene recall field. New patients are automatically opted in for dental recalls, but they have to be manually opted in for hygiene recalls. So as you can see here, it's down for the default dental recall plan, whereas for hygiene, no recalls. I'm going to show you the dental default recall plan by clicking on here and here, and you can see that it's set up for every 12 months, and it's dated from the start of course of treatment, and the date is set automatically. So once I start a course of treatment, a recall date will be set here. And there you can see it. Patients can also have their own plans set up, but if you don't do that, then they'll default to whatever you've set up for the whole practice, the default plan. This box here stores the date of the last medical history recorded, so this patient hasn't had any yet. If I click on here, I can record a medical history. The medical history form opens with all the healthy options pre-selected, so if the patient hasn't got anything wrong, you just have to click on save. And here we can see the medical history is in the notes, and also it's dated here. You can update a medical history on the same day, and it won't create a new entry, it'll just overwrite the previous one. If you do it on a subsequent day, a second entry will be added. So if I click on here, select new history, heart complaint, now it's been updated, and this is in red, and it's in red because not only do we select he's got a heart complaint, we also ticked this box here which tells the program to flag the medical history. The name of the patient's GP is recorded here, and you can select from a list of previous contacts or add a new one.